I love how design and function meet. I went back to design school, and one of our projects was to create and design a healthcare environment. I chose a cancer center, and that really opened up my eyes to the need for nurses to be in the field, because I couldn't find any information about what nurses were saying about how to design an oncology center. As a nurse looking at the design of a healthcare space, my first mind went to, well, how is this space going to operationally function? How are the patients going to get in? How are they going to be most comfortable? How are the nurses going to have their equipment, readily available? And how will they interact together? What we're talking about are the people, which would be the nurses, the caregivers, the patients, the process. How are nurses able to give care in a timely and organized and efficient way? And then the place, what is the environment? How is that really structured in order to help the nurse do that? So that's really the ingredients that are necessary to plan and strategize to create that optimal work environment. Architects, engineers, designers, they don't really understand what all is involved in a particular procedure, particular case. If the nurse has a perspective from a patient empathy standpoint, from a nurse improving workflow, from information gathering, from tactical, like what meds am I going to need, what supplies am I going to need for this. I just represent and really advocate for nursing being there. Nurses can work in a lot of different roles and really create a greater impact, advocating for other nurses at the bedside.
Nurses really can be involved in any aspect and definitely have an impact on that delivery of care, making sure that we take care of our colleagues, and so important to have that clinical voice.